Hi, good evening. Hi, good evening. I'm Dr. Ramani from Motherhood Hospital, Noida. And in today's webinar, we are going to discuss about the parenting tips which one can take during this COVID-19 lockdown. So I'll be running through few important information. And at the same time, if you've got any questions, you can put your queries in the chat box, and as and when the time permits, I'll be taking into those questions. So to start with some general information about this coronavirus. So this is a novel coronavirus or COVID-19. It's a new coronavirus which broke out in the Wuhan city of China on 31st of December 2019. And it belongs to a family of viruses that causes respiratory illness like common cold, SARS, and MERS. So the reason we call it novel is because of the fact that it is new to us. Coronavirus usually infects animals, and they are considered as zoonotic. That means they are capable of being transmitted from animals to human beings. And COVID-19 is one such example. The earlier outbreaks of coronavirus like SARS and MERS, which were there in 2003 and 2012 respectively, were transmitted by cats and camel, and they also belong to coronavirus family. So it's important to know that what is the common way of spread of this coronavirus. So as most of us are aware that coronavirus mostly spreads by the respiratory droplets, or through air by coughing and sneezing. So whenever a person is infected with that virus, and if he or she coughs or sneezes in the atmosphere, the respiratory droplets containing those virus, it can get transmitted in the atmosphere. And then because of close personal contact with infected persons, such as touching or shaking hands, can also lead to the spread of these viruses. And then this virus can also be transmitted through what we call as fomites. That means touching an object or surface wherein the virus is already residing and then touching your own face. Very rarely, there have been different studies which have shown that there could be fecal shedding of the virus as well. Therefore, contamination by orophycal route is another possibility. So once infected with that virus, there is a period called incubation period wherein the virus multiplies inside the body, and then it leads to symptoms. So what are the important symptoms? The symptoms includes fever, cough, dry cough mostly, and the fever is usually high grade, and then breathing difficulties. Very rarely, especially in older people with comorbid conditions, this infection can become serious, but in majority of the population, up to 85% of the cases, it's quite mild variety. Next the questions comes, how can I protect myself? So one of the most important ways is to wash your hands very frequently, and this has been well discussed even in government advisories. Then following respiratory hygiene, using mask and different things whenever you are coughing or sneezing, to make sure that you are not spreading the droplets in the atmosphere. And then avoiding close contacts with anyone who has got symptoms like fever and cough. And lastly, not eating raw or undercooked animal products. So this is extremely important. These are the way one can prevent this infection. Now coming to coronavirus in children. The question is, many a times people they ask me whether COVID-19 can affect children also. Sure, I'll be discussing this in Hindi as well, as many of these viewers have also asked. तो कोरोना वायरस के बारे में ये जानना ज़रूरी है कि ये कैसे फैलता है. जैसा कि मैंने बताया कि ये खांसी होने से, या किसी को जब जो एक व्यक्ति जिसको कि कोरोना वायरस इन्फेक्शन है, अगर वो एटमॉस्फेयर में या खुले में खांसे छींके, उस तरह से फैल सकती है, या उस पर्टिकुलर उस व्यक्ति के साथ अगर संपर्क में आए कोई आदमी, और उस वजह से ये फैल सकता है. कभी कभी जो फोमाइट्स है, जैसे कि डोर हैंडल्स हुए, लिफ्ट्स हुए, ऐसे जगहों पर भी कोरोना वायरस का जो दैट माइक्रो ऑर्गेनिज्म वो काफ़ी टाइम तक उस पर रह सकता है. तो ऐसी चीज़ों को छूने से भी कोरोना वायरस फैल सकता है. अब हम आते हैं कि बच्चों पे क्या प्रभाव पड़ता है, क्योंकि ये सेशन जो हम आज डिस्कस कर रहे हैं इसमें मेनली हम बच्चों के बारे में ही डिस्कस करेंगे. So how coronavirus is going to affect children? तो अभी तक की जो स्टडीज़ आई हैं ये यही कहती हैं कि जो बच्चे हैं उनमें कोरोना वायरस का इफ़ेक्ट जो है वो अगर एडल्ट से या फिर और जो पहले से जिनको मॉर्बिडिटी है, हार्ट लंग्स की कंडीशन है, उनके मुकाबले अगर देखा जाए तो बच्चों में कोरोना वायरस का सिवियरिटी ऑफ इलनेस इज लेस। तो ये वाई डू चिल्ड्रन बिहेव लाइक दिस, इसके पीछे बहुत सारी थ्योरीज पॉस्टुलेट की गई हैं। एक तो ये है कि बच्चे शायद ज़्यादा कांटेक्ट में नहीं आते हैं। दूसरी थ्योरी ये है कि जब भी कोई शरीर में इन्फेक्शन होता है, बॉडी एक रिस्पॉन्स माउंट करता है। मे बी दिस रिस्पॉन्स इज नॉट एज लार्ज एज इन चिल्ड्रन एज कम्पेयर टू अदर एडल्ट्स। ये भी एक रीज़न है कि बच्चों में शायद इतनी तीव्र गति या इतनी सीवियर डिजीज़ जो है वो नहीं होती है। बट एट द सेम टाइम ये भी बहुत जानना ज़रूरी है कि ऐसा भी नहीं कि बच्चे अफेक्टेड नहीं हो सकते। हमारे इंडिया में भी कुछ एक रिपोर्ट्स आई है जहाँ की बहुत कम उम्र के बच्चे भी इससे अफेक्ट हुए हैं एंड अनफॉर्चुनेटली डेथ्स भी रिपोर्टेड है। सो इसलिए इस चीज़ को अप्रिशिएट करना बहुत ज़रूरी है कि ये बीमारी जो है ये किसी को भी अफेक्ट कर सकती है, और इस तरीके से जो है क्या क्या मैन्यूवर्स हैं, क्या क्या चीज़ें हम कर सकते हैं जिससे कि इससे बचा जा सके। तो अगला जो मैं डिस्कस करूंगा, तो सिम्टम्स, जैसे कि मैंने बताया कि बच्चों में सिम्टम्स जो होते हैं वो बड़ों जैसे ही होते हैं। तो हाई ग्रेड फीवर का आना, हाई ग्रेड फीवर से जैसे जिसको हम कहते हैं कि नॉर्मली 100.5 डिग्री फ़ारेनहाइट के ऊपर फीवर आना, कोल्ड एंड कॉफ के सिम्टम्स होना, स्पेशली ड्राई कॉफ के सिम्टम्स जो है ना, परसिस्टेंट ड्राई कॉफ, काफ़ी खांसी होती है, सूखी खांसी होती है, सोर थ्रोट, गले में बाकायदा काफ़ी दर्द बना रहना, इन सब सिम्टम्स के अलावा, और अगर डिजीज़ सीवियर हो जाए तो कभी कभी ब्रीदिंग प्रॉब्लम्स भी हो सकते हैं जिसमें कि सांस लेने की दिक्कत हो। इस तरीके की सिम्टम्स भी बच्चों में आ सकते हैं। तो ये जानना बहुत ज़रूरी है कि ये सिम्टम जो होते हैं ये बाय एंड लार्ज जैसे कि एडल्ट्स में होते हैं वैसे भी होते हैं। कभी कभी रेयरली एब्डोमिनल सिम्टम्स कह सकते हैं, जिसको कि डायरिया होना या उस तरीके के सिम्टम भी बच्चों में रह सकते हैं। ये जानना बड़ा कभी कभी डिफ़िकल्ट हो जाता है कि अगर हाई ग्रेड फीवर है, सर्दी खांसी है, तो क्या ये कोविड-19 का ही इन्फेक्शन है? क्योंकि कभी कभी ये क्लिनिकली या देख कर बच्चे को या एग्जामिन करके ये कह पाना बड़ा मुश्किल हो सकता है कि ये वाकई में कोविड-19 या जो नॉर्मल सीजनल जिसे हम कहते हैं फ्लू है वो इस तरीके का है। तो अभी का जो सिचुएशन है उस हिसाब से अगर देखा जाए तो सबसे बेहतर चीज़ होगी कि अपने डॉक्टर से बात की जाए, और अगर ज़रूरी हो तो कोविड-19 की टेस्ट करके इसको कंफर्म किया जाए कि वाकई में ये इन्फेक्शन है या नहीं है। सो इसलिए इस चीज़ को अप्रिशिएट करना बहुत ज़रूरी है कि जब भी इस तरीके के सिम्टम हो, जैसा कि हमने बताया, वेदर इट बी फीवर और कॉफ और ड्राई कॉफ और कोल्ड or breathing difficulty, you should get in touch with your pediatrician or the child specialist and take a call accordingly. If at all needed, you might be asked to undergo that particular test for COVID-19, and depending upon the results, you will be going through the treatment. So there are certain precautions one can take while keeping your discussing the child at this. While keeping the children at home, what are the precautions that you can take? So important thing is that what we do at home is to make sure that children, just a moment. So cleanliness is again very, very important. So you know that cleanliness, yeah, I understand many viewers are asking me to speak in English, but at the same time there has been request to speak in Hindi. So I'll try to blend both of it. Sorry, I understand that some of you are purely South Indian. So I'll try and speak in English and Hindi both combined so that both of you can, understand. I will come about the newborn babies in a short while. So let me come across. Fine, I'll be speaking English mostly. Now let's come to the precautions that we are supposed to take when we take care of a child at home. So the precautions are by and large the same as we talk about in adults, like following the government advisory, not going out of home if at all, unless it's extremely necessary. Like if it's an emergency visit to hospital, then it's all right. Otherwise, staying at home as much as possible, like we adults are supposed to do. Secondly, maintaining social distancing whenever we have to go out for any reason, children. So we need to teach children how to, maintain social distancing. So these are certain things which we definitely need to follow. Apart from that, there are certain things which we can practice at home. For example, cleanliness. This is, everyone knows what is the importance of cleanliness. So keeping your home clean, your surroundings clean, it does confer immunity and protection from the, not immunity, I would say protection from the virus. Then disinfecting the surroundings. So, certain things like handle, the knobs of the door handles, the lifts, ghar mein agar if you've got different objects which people keep touching, so you should make sure that you are disinfecting such things by repeated use of disinfectants. Even, as I said, if you go out for whatever reasons, are not supposed to take children out, but if you have to take, then make sure that you are following social distancing. And then what I feel that because this lockdown period is something which might not come later on, so I think this is a time frame where you can utilize this time to teach your children, to inculcate some good habits, make them learn new things. You can prepare a schedule for them. Learning and scheduling, I think, is very, very important, not only to fight this corona, but also develop kind of a lifestyle. And especially children who are older, say, more than 10, 12 years old, who do have kind of stress because of it. They might be asking questions that why we are at home, why are we not going school, why I am not able to play with my friends. So it's important that you address those questions. It's extremely important, because unless you address those questions, there will be a kind of fear, gripping inside the child's mentality, which is again not very good. So you should do certain things. You should answer these questions as if, you are trying to relieve the child, rather than, making the child afraid, or, kind of creating a panicky situation. So speak to your child, tell your child that, these are the times where the virus is roaming outside the home. So we have to hide at a place so that the virus doesn't affect us. Something like this, to create positivity in the child. At the same time, you have to cultivate certain hobbies, which is very, very important. Something, you might like your child to play in an act, or maybe, dance, or maybe you listen to a music, or maybe try some singing stuff, something like this. So it's a family time where you can utilize this time to cultivate hobbies. And of course, at times, we as parents, we have to, play a role model. So we have to do things which we want our children to follow. So it's very, very important that you are, using masks as much as possible. You are washing your hands. You are following social distancing. These if you are following these things, if you are doing these things, then it becomes easier for the child to, imitate you, and the child will definitely follow this thing. I got a question from Girish saying that, doctor, does sari in children is same as corona? Girish, as I said, this infection is basically a kind of respiratory illness, and it is one type of ACRI, which is severe acute respiratory illness. But the corona infection is slightly different in terms of how it affects. The pathophysiology is still being studied, but the overall, I would say, the impact is the same. But because this virus is so transmissible and so easily transmissible from one person to other person, that's why I think this is a huge impact of this illness. So mortality might not be at as high as many other diseases, but because this disease is so much transmissible, it creates so much global influence. Then I got a question from Krishna Ranjan: what precautions to be taken while purchasing daily need from shopkeepers and vegetable hawkers? It's a very good question. I think first of all, when you are going out, it's very important to follow what the government advisory is, making sure you are following social distancing, making sure you are using your masks as per local authorities order. And then you should try to minimize contact with people as much as possible. And whenever you are bringing outside stuff, try to get rid of those plastics, and whatever you are carrying outside is good. And if we are bringing your vegetables, if you are cooking these vegetables properly, even if there is a virus, it will get deactivated. So it's important to eat the cooked food. That's very, very important. You are not supposed to eat raw vegetables. and clean them properly. Even the same thing applies with milk and other meat products. So you don't have to eat it raw. Make sure that you are warming and heating, so that will take care of the virus. So I would say making sure while purchasing you follow the government advisory, getting rid of coming in contact with as less possible as as much as possible, and then making sure that you are eating properly cooked food. That is another very important thing. I got a question from Subham that a raw and uncooked food to be avoided. Shubham, there is no, I would say, hello. Sorry, maybe I got disconnected for a bit. Subham, about the question about uncooked to be avoided, well, there is no evidence as such that coronavirus can spread from fruits. So I think if you're washing your foods properly, that should take care of it. There are no recommendations of boiling these vegetables before use, but 100% it's sure that any animal products that has to be cooked before you eat those products. So I think if you are following those norms, you should be fine. Right. So I'll carry on with the preventive part. So next, there is a very common, inquiry from parents about vaccination, whether we should be, going ahead with the vaccination. So the different government advisories that have been issued, as well as from the Pediatric Association, that vaccination comes under essential medical services. So there are certain vaccines which we can't avoid for long, especially the 6 weeks, 10 weeks, and 14 weeks vaccination. These are the ones which are protective, and it is important that you talk to a pediatrician, and then you can kind of plan it out after talking to a pediatrician. Of course, you have to take all the precautions as per government advisory. So the 6 weeks vaccination, which includes your DPT, hepatitis, pneumonia, these should be given as soon as possible. At the same time, 9-month vaccination like MMR, measles, MMR, there has to be, again, you can't delay it beyond a certain point. So you should be talking to your pediatrician. That's very, very important. Let's move on then to the next slide. So about newborns, again, there are some questions of what special precautions we can take for taking care of a newborn baby. So from newborns, the same care that we are offering to other children is the same. There is not much different, but at the same time there are concerns with feeding and stuff. So as this moment, we are not 100% sure from the data that we have whether coronavirus can spread vertically, that is from mother to the newborn infant. But there are 1 or 2 cases where it has been shown that it can spread. So once the mother is positive, so the mother and the baby have to be they have to be nursed separately. And regarding feeds, there are different guidelines which say that express breast milk can still be given, but of course there are ample precautions that has to be followed, so that the mother and the children, I mean mother and the newborn baby, they are nursed separately, but still the baby can have the benefits of express breast milk. So it's important to appreciate that it's very, very important to follow the local guidelines, plus the obstetric and the pediatricians guidelines whenever there is any such incidence of mother being positive and newborn being separated. Now coming to the next slide is how to deal with children at home. I know this is a very common question, and it's not easy to deal with children while at home, because children also, they feel little agitated while remaining at home all the time, and for parents also it's not a very common situation. So I think it's there are certain guidelines which have been published by UNICEF, and they very clearly say that what can be done at that in such situation wherein children are staying at home all the time. So I think it's very important to set aside time and to spend quality time with each child, and you should ask your child what they want to do. And I think talking lot and lot to your child is extremely important. Again, as I've already discussed, that you should use this time as a quality family time to build good, positive habits, and something which goes a long way in securing physical, mental, and emotional well-being. So I think discussing, especially if your child is a teenager, then ideas with your teenager about something like sports, music, celebrities, cooking a meal together, something like this. And also, I think you should make sure that you are minimizing the screen time of children, because it's quite possible that while this lockdown is still going on, children might be using a lot of mobiles and television. So try to minimize the screen time as well, and try to make a schedule, a habit on how to do from morning till night before sleep, where the time has to be utilized. So it's very, very important, and I think it's important that the children are engrossed, and they feel doing something all the time, whether it be painting, dancing, music, anything. So I think these are the ways which can help you to make sure that you can use this time as quality time. Right. Any more questions from a children's point of view? I'll be happy to tackle here. Anything that you want to ask about children? So I got a question about stress also. I think stress management is again very, very important during this time. Uh, the stress in children as well as stress in adults, that has to be addressed very appropriately. It's very common to get confused or agitated because of this situation. Nobody was expecting this, and suddenly it's been forced onto us. So it's very difficult at times, but at the same time we have to accept that because it's there, it's not something which you can avoid. We have to follow by the government advisory, which is again very, very important. And make sure that you are exercising daily. Even at home you can do certain exercises. Make sure your diet is good, like you're eating lots of healthy diet, good quality, I mean good quantity of water, making sure that your hydration is okay. And then making sure that you are taking good rest and sleep. Make sure that you are not taking too much of caffeine. So these are the things which you can employ to to reduce the stress levels. And at the same time, as I said, that we should be using this lockdown time to improve oneself as a person, and I mean whether it be a physical, mental, or spiritual well-being. And the same thing applies for children as well. So making sure that the family as a whole understands this, that this time is not easy, but at the same times, when we are staying at home, when we are following social distancing, when we are using masks, we are helping each other in just combating and tiding over this very difficult period. So I think if we follow government advisory and make sure that we take care of these precautions at home, it'll make sure that we go a long way in preventing this situation. Any more questions? I'll be happy to tackle about, especially related to children. I think I have answered about vaccination and how to take care of children. Any more questions? I've got a question from Ritesh asking that it has been observed that 50% of the cases do not have corona symptoms. Please share your thoughts. So Ritesh, this is a very, again, something which has been said, that this coronavirus infection, if you talk of in totality, out of 100, 81 to 85% of the people will have mild infection, and in fact many of them might not have very obvious symptoms as well. So only 15% people, they have some moderate to severe infection. 5% of the people may have very severe infection which might need respiratory support. So now why do these people don't have symptoms, it's very difficult to say. But as I said, that the age does contribute a lot. So people who are older, especially more than 60 years, and who have got, underlying risk factors, as government also keeps telling that they are at a high risk, and therefore these people should be protected. If you talk about whether we as Indians are having less symptoms, I think data so far, if you see the graph of India as compared to the European countries, I think we are definitely doing better, and probably we are in a position to flatten that graph as well. So there could be multiple factors playing here. One thing could be temperature. As of now, we don't know exactly how much effect the temperature would have on this coronavirus spread. But there are studies which have shown that it's quite possible that with the temperature soaring again in coming future, it is a possibility that it may kind of decrease the transmission rates. There are certain other things in us, like BCG vaccination, living in an endemic area of malaria. So these are the certain things which might confer some protection to Indians from corona infection perspective. But again, because I said this is a novel virus and we are still studying, we are still not very sure of the epidemiology and the treatment. So a lot of data is still coming up. At this point, it's very difficult to say what's going the immediate future is going to be. But as of now, I think the government has done a wonderful job, and we are in a position to flatten that curve. Although in coming next few days and months, the more data will come out, and will be in a better position to know where we are standing at this moment. I got a question from Deepika Khanna asking, is there any immunity boosters to be given to children, in diet to children? Deepika, unfortunately, there is no proven medication which kind of enhances immunity in children. Of course, there are certain ways which can help, especially not only children but to any adults. So I think making sure we are doing good physical exercise. In children, it could be anything. I know it's not easy being at home and exercising, but you can ask children to follow you what you are doing. So exercising is one important thing. Making sure your diet is good. You are not giving a lot of junk food to your children. You are adding good, healthy, balanced diet and enough water. That is again very important. Making sure your children are getting adequate, rest. So these are the things. If we do it on a consistent basis for a long duration, it definitely kind of it boosts the immunity, not only in adults but also in children. If you talk of medicines, as such, I don't recommend any immunity boosters, although there are multiple compositions available in market. But if you go by science, there is nothing which is known as immunity booster. Of course, there are multivitamins which can be prescribed if there is indication to prescribe a multivitamin. But to just blindly follow any immunity booster, I don't think this is the best thing to do. I got a question from Shweta asking how to help children cope up with this situation, also guidelines on their diet page. Shweta, I think I discussed this thing, but I think we need to understand that this lockdown period not only has got impact on the social life, but also on mental status of children as well. So it's important that you talk to your child, depending upon the age. If the child is a teenager, that definitely he or she will be feeling more stressed because of it. It's important to keep chatting to your child, making sure your children are busy at home with whatever activities they are happy to do with it. uh, you know Spending a quality time with them as in is very, very important. From dietary point of view, I think if you make sure that they are taking good balanced diet, there is nothing special in this situation. But at the same time, taking good amount of vitamin C, I think, especially in citrus fruits, it does kind of gives immunity against respiratory infections. To some extent, you can say it does, give some immunity. But again, it's not something which will help preventing coronavirus infection. And again, then making sure that you are giving good enough water hydration. If the hydration is okay, that goes a long way again in making sure that whatever the ill effects of the infection, be it corona or any other viral infections, the it's easier to fight a infection when we are well hydrated. Any more questions? I'll be happy to tackle. Then I got a question from Ritesh. What do we suggest for the newborn babies? So for newborn babies, first of all, the most important thing is to know where the mother is affected or not. If mother is not having any symptoms of corona, or if she has tested negative for it, I think we follow normal routine for newborns, like breastfeeding and being at home, not going outside unless it's absolutely necessary. You might be asked by your pediatrician or neonatologist to come to the hospital depending upon the newborn's condition. So as and when required, you might have to visit hospital, but make sure that you are following all those norms which are supposed to be followed in hospital, like use of proper masks, making sure your hands are being washed every now and then, use of sanitizers which have got at least 70% alcohol. So these are the way you can take care of the newborn babies. Yes, and making sure that you're of course practicing cleanliness and hygiene at home as well. So that goes a long way again. And then there is a question from Jazz: feeling a stress with loads of work during this lockdown. Sleepy is also gone after. I do understand, Jazz, that that's not the easy time for all of us. But I think the best way to get de-stress is to sometimes just you should not think of these things. Just unwind yourself. Just solve a puzzle, sing or dance. So you just don't have to think, and don't see a lot of television, and don't follow too much of social media, because sometimes many of the messages and the news which is percolating is not true, and it unnecessarily adds to our stress. So I think it's important that you are following government advisory, relying on what is called the verified source of information. That's very, very important. So and voluntarily or involuntarily, sometimes also we kind of we pass on such message which we ourselves are not very sure. So it's very, very important that you are making sure that you follow the verified news. To take care of the sleep, again, it's very, very important that you are not spending a lot of time on mobiles. Your screen time should be limited. Make sure not you are having a lot of caffeine, I mean coffee and teas, which is very common kind of thing when you are staying at home. So if you are taking a lot of tea and coffee, that might also hamper your normal sleep. And if you could exercise a bit, I think when you exercise, there are good hormones which are produced in the body, and they definitely help in making sure that your sleep cycle is regularized. So if you follow these things, I think it will be helpful. um, I understand that these are difficult times, but at the same time you have to accept it. Whenever there is a new situation, the first thing that I respond by is getting fearful, and then after the fear is over, you will definitely and come and you will know that we are learning, and then lastly you will start improving on yourself and contributing to the family. So I got a question from Krishna Ranjan. Hi, Bhaiya. So what precautions to be taken while exchanging currency notes at shop? Can it be a carrier of COVID-19? So although data is lacking as far as exchanging currency, but there are some governments internationally who have kind of they have issued guidelines over minimal use of currency. I think the best thing to do right now is to use digital media for payments. If you can do that, that will be really helpful, and that will also make sure that you don't come in contact with many people. So if you're able to use it, I think it's a very good move. Avoiding currency, exchanging currency is I think is a good thing to do. Any questions? Any more questions? I'll be more than happy. Jazz, so there is too much work to do that there is no time to take rest. I do understand, Jazz, that there could be professional and peer pressure at this moment. I think you need to talk to your colleagues as well, how you can help each other at this moment. I think talking to your friends is again one important thing that we can do, especially talking to your old friends, and it kind of releases a lot of stress. So get in touch with someone whom you have not been speaking to quite late. Then I have a question from Sagar from Pune, and how it affects to a person who has a heart rate and angioplasty in last 8 months and age group 40 to 45 years, otherwise healthy. Sagar, I think so. Any comorbidity, we have to be very, very careful. It's been clearly explained by government guidelines as well. So, some people who already had any ailments of heart, lungs, kidneys, they are having an increased risk, I would say. Not that every person having such problem will have a severe degree of illness, but at the same time, any person who has got any pre-existing heart, lungs, or kidney problem, the chances that this corona infection might complicate is higher as compared to other people. So I think it's very, very important that we are following necessary, precautions and abiding by the government guidelines. It's extremely important. If there are no more questions, I would just wind up. But is there any more messages or any more questions? I'm happy to tackle it. Otherwise, I'll just wind up. There's a question from Nistha. If mother is facing issues of sneezing, then can she feed her baby or avoid touching? Nista, so as I said, the guidelines which are released by the Indian Council of Medical Research (ICMR), it clearly says that any person who is having symptoms of influenza-like illness, which includes high-grade fever, cough, or severe cold, this person should be tested. So if mother thinks that she is having significant sneezing, I don't say once or twice just because of AC being switched on or because of allergy, but if somebody seriously thinks that one is having fever, dry cough, sore throat, significant sore throat, or is sneezing, then they should definitely get in touch with their doctors, and if really necessary, they might have to undergo testing as well. Then Hemant has asked a very good question. When can we expect the vaccine for corona? Hemant, I really appreciate your question, but at the same time, to be honest, at this moment, we are not in a position to say when. There are many scientists who are working on it. There have been, some news that by this year end we might have some vaccine, but when a vaccine has to be released for general use, it has to undergo 4 stages of testing. So we are still quite early, in the process of release of this vaccine. Once we have the formulation, it will be released for testing, and once we complete that phase, then only it will be available for general use. So I think it's still going to take some time, probably. I can't say exactly when, but as far as I know, maybe early 2021 we might have something. So unfortunately, we don't have a clear-cut answer to where as to when we expect the vaccine for corona. And then again, I got a question from Jazz that sitting posture is also a problem, not proper place to sit for long hours. Jazz, I think if you exercise yoga and some simple exercises, stretching exercises at home, that might be very helpful. I know it's not easy to work from home as well. For many of us, it's not the best thing or not the commonest thing that we have done. It's an unprecedented situation, but if you take care of health by using certain stretch exercises and yoga at home, I think that might be very helpful. Unfortunately, I'm not an expert of physiotherapy. I will not be able to tell you what exercises, but all I can gather is that certain exercises will definitely help you with this. Got a question, another question from Krishna Ranjan asking, is there any risk from newspaper taking newspapers from hawkers? Well, so any person who is infected might transmit this virus. So we don't know exactly. But as far as I know that any fomite, any object which has got the virus carries a risks. So we don't know 100%. Although there was some advisory from government saying that there is minimum risk from newspapers. So I think, to be honest, unless you know a person, if a person is exactly not having symptoms, I think it's best to avoid. And then if there is no, another question from Hemang, if there is no vaccine, why is US ordering hydroxychloroquine from India? Well, it's a very tactical answer. I would say that hydroxychloroquine has been shown to be helpful in people who are severely affected by this virus. This has nothing to do with vaccine, Hemant. Hydroxychloroquine is a drug and is not a vaccine. You have to understand that. And hydroxychloroquine and certain other drugs, especially the antivirals, have been found to be useful when people who are having severe disease, whether when it is used in people who are having severe disease, it has been found to be useful. Although we don't have a concrete data as to exclusively or conclusively say that hydroxychloroquine is the drug of choice and will treat 100% of the people affected by it. But of course, it has been found useful in treating patients who are severely affected by coronavirus. And Subham has got a question. I give my son lukewarm water in the morning and night to drink. Hope it's fine giving. Yes, lukewarm water has got no harm, Subham. Although I really doubt whether it will help in preventing the coronavirus. But lukewarm water as such has got good health effects. So it's well and good. You can use it. That's not a problem at all. I think if the questions are done for the time being, I like to wind off. If there are any more questions, you can drop into this chat box and we can definitely address that. I hope you found this session useful, and I would suggest follow government advisories, follow social distancing, use masks, wash your hands as much as possible, get and try and be stress free as much as possible at home. So these are the things which you can follow, and I'm sure you will be safe with this. Last question, I think this I'm gonna take is from Hemant. Is there any link which gives proper information about lifespan of corona on different materials like soil, silk, cloth, floor, plastic? Hemant, to answer, there are guidelines on CDC, which is called Center for Disease Control, United States of America. But rather than spending too much time about knowing this thing, I the best thing is to follow universal precautions. So whenever you are not supposed to touch those things. If you touch those things, you make sure that you are cleaning your hands, you're using alcohol based hand sterilizers, and try to practice home also, that you are not touching your own face after touching any fomites. And then Basanta has got question that if somebody is already having allergy of sneezing and running nose, has it to take any extra precautions? Well, if there is no fever and there are clear-cut signs of allergy, Basanta, then I think whatever precautions you are taking is good enough. Talk to your doctor. You might be prescribed some anti-allergic medicines. But if there is any other symptom like high-grade fever or dry cough, then you should also talk to your doctor whether you need testing or anything else. So I think that sums up this session for me today. I hope it was a useful session, and please do let me through your uh, uh, through the chat boxes. You can just drop me a message. How did you find it? And if there are any more questions to tackle, we can definitely take that. Thank you for your kind and patient hearing, and thank you all. Thanks a lot.